According to the CDC, more than 38 million Americans are affected by type 2 diabetes. That's more than 11% of the population. Top risk factors include body composition, age, family history, and race or ethnicity. Type 2 diabetes is associated with increased mortality in ethnically diverse populations, including Hispanic, African American, and Indigenous American adults. Joining us today to discuss critical steps you can take to prevent and manage diabetes is Dr. Heidi Schwarzwald, Chief Medical Officer at Signify Health. Welcome.
Good morning.
Now, Doctor, who is at greatest risk for developing diabetes?
As you mentioned, those who are of Hispanic or African American descent can have up to a 60% increased risk of being diagnosed with diabetes. Most people are actually diagnosed between the age of 45 and 64. Of course, there are other risk factors as well, such as your weight, your food choices, and the amount of exercise you get. Those types of things can either increase or decrease your risk for diabetes.
Now, understanding that there are modifiable and non-modifiable factors, what steps should people be taking to prevent and manage diabetes?
There are so many small things you can do. Reducing your weight by 5 to 10%, increasing your exercise or the amount you move even a little bit, up to 150 minutes a week, as well as those food choices that you make. Some of those small changes can reduce your risk up to 50% for developing diabetes or help control your diabetes. It's also really important to know your numbers. What's your weight, your blood pressure, your cholesterol, and of course, your sugar or your glucose.
And it all starts with being aware of your blood sugar or A1C levels. When and how should you start getting screened for diabetes?
Yeah. Surprisingly, the American Diabetes Association actually recommends you start getting screened as young as 35, particularly if you have some of those risk factors we talked about. Signify Health might be able to come to your home to do an in-home health assessment to help get you screened, as well as help you make some decisions about ways you want to change your lifestyle to help reduce your risk. These visits are very frequently available at no cost to you.
And how can you book an in-home health evaluation with Signify Health?
There are a couple different ways you can book an in-home health evaluation. Call the phone number on the back of your insurance card, your health plan card, to find out if you're eligible for these no-cost visits. Or you can go to hellosignify.com or holasignify.com to learn more and to book your appointment.
Dr. Schwarzwald, we thank you so much for this critical information and these strategies to safeguard our health.
Thank you.
And we thank you for joining us on San Diego Living. We'll see you next time.